much, especially Professor Javed Akram, Dr. Aftab Mohsen, Dr. Somi Iqtidar, my brotherly figure, Dr. Tariq Wasim, for giving us this opportunity to talk to our fellow colleagues. And I think many of them have traveled all the way from their different cities to attend this conference, which is again a marvelous effort this year by from Pakistan Society of Internal Medicine. So my job this evening is to review for you in a global way what insulin resistance is. Because I personally think that that's a truly an untold truth. And why this truth has not been propagated across the masses, and especially in the medical community, you will learn after a short while. These are my disclosures. Nothing to disclose because this is a non-sponsored sort of presentation. And why it is so, you will again know at the end of this talk that such presentations are not sponsored by the industry. These are my disclaimers. The presentation should be taken as a medical and academic purpose only, and it should not be taken as a personal medical advice for any of our audience. Facts and figures which are being presented are backed up by the solid evidence and expert reviews, and it is not based on the personal liking or disliking of your presenter. Evidence is available on request. So, may I ask a simple question right at the outset? When we talk about insulin, what is the first thing which comes into your mind? So you all think that insulin is a glucose-lowering hormone. Diabetic patients use insulin. It is true. Insulin lowers high blood glucose levels. It is true. But American Diabetes Association says that insulin is a glucose-lowering or diabetes hormone. Unfortunately, that's not true. Insulin has a lot of other important tasks to perform in the body. So we can say that if insulin lowering is the most known or most famous action, but this is not the most important one. From head to toe, we have at least 10 trillion cells in our body. And there is none of these cells which doesn't have an insulin receptor on them. Insulin tells virtually every cell of your body to do something. So glucose lowering is the famous action of insulin, but not the most important one. So what is insulin resistance? Insulin resistance always comes in a pair. This is basically two sides of the same coin. One side is insulin is not working at some cells of the body, not all. Majority of the cells of the body, they retain perfect potency to respond to insulin throughout the life of a person. But some cells of the body, they don't respond to insulin in a way it is used to. Side 2 is, which is often overlooked, is chronically elevated insulin or the hyperinsulinemia. They always come together. Then there is nothing like that one side is there, although we are much familiar with the first side of the coin, that is insulin not working. But insulin not working at different cells, it never comes without the company of hyperinsulinemia. Now, I would like you to focus on the screen. I am going to elaborate this thing in a cartoon way. Now, this, this tea pink color is like a cell. This is a cell. And ये जो ऊपर PSL की wickets आपको नजर आ रही हैं, ये insulin receptor है on the cell surface. What happens is that insulin molecule comes and knocks at the door of this insulin receptor to open the doors of the cell. It is the same way which happens at your doorsteps. Somebody comes and knocks at your doorstep, and something unusual happens inside the home. If you have little kids inside the home, they try to fight with each other, who will reach to the gate and who will open the gate. If you have a little puppy in the house, it will start barking. And let's call all this as an action. So something in the form of action coming that starts to happen inside the cell. And with that, glucose travels in. This is the normal way. But with the passage of time, the cells become more resistant and they don't open the door. So the second side of the coin comes into play, that these insulin molecules, they are increased in number, and this is called hyperinsulinemia. So this action, which was weakened by the first side of the coin, is now temporarily restored back, but temporarily. So these are the two different coins. If you are not still able to understand, these are the perfect examples. On left side, the first side of the coin, insulin is not working. It is very beautifully presented in erectile dysfunction when insulin comes, knocks at the door of the endothelial cells to open the doors, and they also advise these cells to secrete nitric oxide. But with the passage of time, when there is insulin resistance, this nitric oxide is not able to cause the vasodilatations, which leads to ED. And on the other hand, the second side of the coin, hyperinsulinemia leads to PCOS. I will not go much into the details. PCOS are the result of hyperinsulinemia because the theca cells of the ovary, they retain a perfect insulin sensitivity throughout the life, and now insulin asking to do more, and that ends up into the PCOS. Just your focus on this slide. This yellow color is glucose and this green color is insulin. So, first of all, you just concentrate on these dotted lines. In the first half of this slide, you can see this insulin resistance from the dotted line number 1 to dotted line number 2. Here, this is the state of normoglycemia but hyperinsulinemia. Glucose is normal, yellow line, but this green line is, going up. And this period is extended over 10 to 15 years. So this is the period we miss. And we wait for the next half when this insulin resistance plateaus or slightly comes down, but your patient is now in the realm of overt diabetes, and we are always very happy during the first 10 to 15 years not addressing insulin, rather waiting for the patient to become diabetic and put him on various medications. And this insulin resistance starts first at the adipose tissue, traveling to the muscles, then liver, and finally to the pancreas. Just like we have non-alcoholic fatty liver disease, we have non-alcoholic pancreatic disease, and we say that pancreas is not working. Actually, it is clogged by the undue or the ectopic fat. And this is the result. We have conglomerate many of these, modern day diseases which have one common step, that is insulin resistance. So rather than pruning these different branches with different medications, why not to cut this, stem of insulin resistance? And these are, which I call the plagues of prosperity. You can see number of different diseases which are attributed to insulin resistance. Insulin is either directly responsible for these problems or has its hand in these problems. Out of this, a galaxy of modern day diseases, these are the top 8 diseases which chew up at least 75% of the healthcare budget. And unfortunately, these are all the symptoms of the diseases. These are not the real diseases. Diabetes is not a disease, it's the symptom of the disease, and so is the true for all of these problems, and we will see why it is so. So, Look at this bowl. What message can we get out of it? When इस bowl को आप इंसानी body ले लें, and when we overfill it with sugar, and you know that now we are consuming at least 40 to 50% more sugar from our ancestors. Almost 80% of your grocery items, they are spiked with sugar, and especially the high fructose corn syrup. So when this bowl is overfilled, it spills out, and this is called, this sugar when spills out, this is called diabetes. And the reason is that we spend every waking moment of the day eating something. We start our day with a sugary and dessert sort of breakfast, then mid-morning snack, then lunch, evening snack, supper, nighttime snack, and until we wake, we are eating something. So always our insulin levels are high. And this is the main cause of hyperinsulinemia. No, this is an overflow phenomena. You can see over here that they are trying to push glucose inside this compartment, and there is no room whatsoever. This is insulin resistance. और इसके second part क्या है कि हमें insulin जैसे ये ठोस रहे हैं, हमें soldiers बढ़ाने पड़ेंगे ताकि ज़्यादा लोगों को inside हम धकेल सकें. और ये एक another beautiful presentation of this overflow phenomena of insulin resistance. जब आपने पूरा बैग भर लिया तो आखिरी चंद जोड़े अंदर नहीं जा रहे. अब मैं क्या करूंगा, मैं इसके ऊपर बैठूंगा, एक और बंदे को बुलाऊंगा, हाइपरइंसुलिनीमिया, जो उसकी जिप को बंद करेगा, 2 बंदे आएंगे. एंड दिस इज what actually insulin resistance is. Causes: too much carbs, high frequency of eating, plus the processed food. Food Panda, thanks to Food Panda, putting everybody in this country on the verge of insulin resistance and diabetes. Inflammation, active phase of rheumatoid arthritis or any autoimmune disease. Stress, acute or chronic, which leads to the rise in adrenaline, noradrenaline, and cortisol. Consuming omega-6 rich seed oils. Every processed food is now being, it's using this omega-6 seed oils, which contain the linoleic acid, which is the detrimental toxin for your mitochondria. Insulin itself causes hyperinsulinemia. And environmental pollution, most important. How to diagnose? Little overweight and hypertensive, almost confirmed. Kisi test ki zarurat nahi hai. Patient is already living with insulin resistance. Then you have seen these skin tags and this acanthosis nigricans. इसमें skin tags most common है. Acanthosis nigricans से ज़्यादा ये skin tags common है. And if you want to know, are you insulin resistant or not, look at these questionnaire. And if you answer yes to 2 or more of these questions, you are most likely to be insulin resistant. And I am sure you are. Lab work क्या करना है? Fasting blood glucose level कराइए, fasting insulin और lipid profile करवाइए. You can get all the information from these simple 3 tests like this. If fasting insulin is less than 10 micro units, good. 10 to 15, warning. More than 15, insulin resistance is confirmed. Triglyceride to HDL ratio, less than 1.5, insulin sensitive. More than 1.5, insulin resistant. Then HOMA-IR, fasting blood glucose multiplied by fasting insulin, divided by a constant 405, and interpretation is right in the line below. Additional, you can go for the ultrasound scan to see the liver fat and also the liver function tests. Treatment, फिर उसी बाउल की तस्वीर. आप इस बाउल को पहले खाली कर लें. पहले उसको खाली करने का तरीका कि बाहर से इसमें चीनी डालनी बंद करें, नंबर 1. और उसके बाद इस बाउल को खाली कर दें. खाली कैसे करेंगे अभी हम देखते हैं. बाहर से चीनी डालनी बंद कर दें और जो एक्स्ट्रा चीनी है उसको खत्म कर दें, आपकी शुगर ट्रीट हो जाएगी. एंड दिस इज How do we treat it? Cut the carbohydrates, prioritize protein, and fill with the fats. If you don't cut the carbohydrates, at least control the carbohydrates, prioritize proteins, and don't fear fats. Apology from the cardiologist. And along with all these 3 or 4 modalities, which gives you a perfect recipe to control your blood glucose level. Important take-home messages. Type 2 diabetes is not a chronic progressive disease. It's a big lie. Rather, it's a reversible dietary disease. Treating type 2 diabetes with insulin gives beautiful control of the glucose temporarily, but makes everything else worse. Like an insulin-treated patient has a 3-fold increased risk of cardiovascular death, 2-fold increased risk of Alzheimer's disease, 2-fold increased risk of cancer mortality, and this is apart from the 20 pounds of weight gain for the first 3 to 6 months of insulin use. Exogenous insulin increases insulin resistance. Full stop, no question. मीर क्या सादा है, बीमार हुए जिसके सबब उसी तार के लौंडे से दवा लेते हैं. इंसुलिन रेजिस्टेंस ने बीमार किया और इंसुलिन एक्सोजिनसली देके हम उस फिनोमिना को मजीद बढ़ावा देंगे और अपने इंसुलिन रेजिस्टेंस बढ़ाएंगे. And this is a standard medical box of a diabetic patient with 12 or more pills because they are suggested 1 pill each for each and every problem they describe to their physicians. And this is diabetes. It is treated with discipline, diet, drill, and drugs way down the list. Everything where you can see the D, the role of D in the diabetes. But how do we treat it? Everything upside down. Drugs at the top, everything else on the bottom, and that's the reason we are not getting the result. And अगर हम ये सब कुछ करें तो फिर इस डी का जिंदगी में आना कोई ऐसी मुश्किल बात नहीं होगी. This is Sir William Osler. One of the first duties of the physician is to educate the masses not to take medicine. ये मैंने नहीं कहा, ये modern day का medicine का जो इमाम है वो कहता है. So, since we cannot change the reality, let us change the eyes which see the reality. Thank you very much for your patient listening.
Mr. Chairperson,